Megan Prichard is with us today on our podcast. And I can't wait to get to know Megan a little better because she works with John James at Kikino Massage Institute and Academy here in Plano, Texas. And you're a midwife.
Yeah.
Well, Megan, why don't you tell us what you do?
I am a registered nurse originally, which I've been doing since 2007, which has been a hot minute. So I got to start and be fully dipped in Western medicine, which was everyone's favorite experience. And then I had my son with a midwife in 2012. So I didn't even know midwifery existed until then. And then it was like eyes wide open on natural health, holistic health, all of the things. And I could not look away. So when he was 2.5, I went back to college again and studied for years and became a midwife. So I'm licensed in Texas and Oklahoma. I live way north of Plano. I commute delightfully every day. And it was being a midwife that actually brought me into bodywork because I came as a referring provider and brought a family with breastfeeding issues and latch issues to John, who I've known for a decade. Just didn't piece it together and realize actually what he did. So I've known John and Michelle for a long time and could have literally been using this for years. And I look back on it and I'm like, well, dang, this would have been super helpful for me to have pieced this together, but I didn't. So anyways, here we are. I referred clients to John and I came to those appointments, which I didn't realize was kind of a weird thing to do at the time, but I did it anyways. And was just completely blown out of the water at what bodywork can do for moms and babies and the bond and breastfeeding. And then at some point in there, I started researching what is it you're actually doing and how do I learn how to do this? So John trained me personally as well in a bazillion visits, it feels like at this point. And yeah, and the rest is history. And now I'm a master level therapist at Kikino, treating women's health. I also do intravaginal work and pelvic attunement. So I'm clinical along with being bodywork trained. So I can work intravaginally, interrectally on people and it be very legal. So, but also bringing that in with the bodywork mindset of how do we take out restriction and how do we treat the body holistically? So a fruit salad and jamming that all together.
That is a lot. Gosh, it feels like you're a jack of all trades, but you do have a master in something. It's not master of none. It's
right.
The master of women's health, maybe.
Women's health. Yes.
I mean,
very women focused. I'm not anti-treating men, but right there on the edge. I want to give all of my focus to the moms, to the babies, whether you've been a mom you're a new mom or whether you've been a mom for 40 years, let's do this. And then the women who've not had babies as well. So yes, I'm about as women's health as you can get through all of the lifespans. And then I like the under 18 crowd for body work as well. So yeah, I like to joke that I have career ADD. I'm just lucky that it's all been in the same direction, that I'm not also randomly a butcher or a professional bingo player. I could have really added a little bit of everywhere. But thankfully it's saying holistic health, holistic health, holistic health, holistic health. So
yeah. You've got a path that makes sense. I mean, you do have a lot of things going on in your world, but it does kind of all work together in this bigger puzzle piece of, like you said, holistic healthcare.
Right.
Can you explain to our listeners what intravaginal work is and why you would do it and why it's even a thing?
Absolutely. So I was originally trained by a naturopath to be doing intravaginal work, which is body work for the tissues that reside inside the perineal vulva area. So I'm also doing external work as well. The reason that we would be doing this, I treat a lot of cases of pelvic organ prolapse. So when our bits are just not quite where they should be, and we're experiencing symptoms with it. Are we leaking urine? Do we have a bad case of the sneeze peas? Is intercourse painful? So I do a lot of talk about what a lot of people are still considering really taboo subjects. Like, you're going to come in and like one of the first words out of my mouth, we're going to be talking like, is intimacy painful for you? Is intercourse painful? Do you leak when you pee? You know, and a lot of times women are like, okay, I hear all the time, like, people never talk about these things. Well, no, but we need to be, because, the advice our grandma gave us, well, we just pee a little when we sneeze after we had babies. That's not good advice. We should not pee when we sneeze after we have babies or before. So the bring it into not being a pelvic PT or a pelvic OT, I am not exercise and fitness based at all. With all of this, I am coming at it from a completely different angle. I'm coming at it with a heavy, heavy, heavy aspect of trauma. Well, where can we look in our past experiences? Where has our body either not been used appropriately or like gently? And do we have obstetrical trauma, gynecological, sexual trauma? And how do we work in this interwoven process to help you to release these restrictions? So we're looking at somatic work, somatic release, myofascial release, lymphatic drainage, visceral manipulation, and teaming all of these things together with a clinical mindset of how do we make this pelvic floor the best that it can possibly be with whatever we're bringing in. And by doing these really simple things, I'm seeing people that at the beginning of the appointment that they cannot get their brain to fire on how to even do a Kegel. I'm not pro Kegel. I do use it as an assessment tool, but to see kind of where are you at? Where is your pelvic floor at? Do your muscles contract evenly, or can you not? Or are you ready to hear like, which is so many of us, right? Or we have no sensation after we have babies or after we've had a pelvic injury, and we're just kind of numb. So this is taking all of those mini points and giving a woman a really safe place to just lay it all on the table, to bring all of these details and say, look, I really want to jump on the trampoline with my kids and not pee myself. Can you help me with this?
Yeah.
And that's what we do. I work through the entire body. The appointments are about 75 minutes. So it gives me lots of time. I mean, we talk the majority of the appointment. I am not a relaxing spa-like experience, Julie. We're going to hash it out. We're going to talk about your childhood. We're going to talk about your births. And then I'm extremely belly work focused, because if we have a diastasis recti, if we have an abdominal separation, all of that ties in. Do we have oral restrictions? We directly mirror from our pelvis to our jaw. So we have to look at all of the different things. So I'm working through your entire body. And then if the woman feels comfortable, and we're doing some very gentle pelvic work. So, which is intravaginal, but is not a clinical feeling experience. So the woman typically has their legs relaxed and laying down. We're in a completely stirrup-free zone. Like, your legs are not up by your ears for my convenience. Like, it's very, very different. And I'm using one single well-lubricated gloved finger to work slowly and gently to see. And in so many cases, just reorient you with your own body. Because for a lot of people, it's incredibly empowering to have someone explain to them, this is where you have scar tissue from your delivery. This is where your bladder is sitting a little bit low in your pelvis, or your uterus is flexed in an unusual direction. And here's what we can do to help improve your symptoms. So, and here's what your body's doing. And here's, a different position that you can try sexually based on your vaginal depth that could make all the difference in the world. So,
Megan, I can't imagine that when working with the pelvic floor and what you do, that you're not triggering some really deep emotional stuff, especially relating to sex. And I can't imagine that
Absolutely.
that doesn't, spark trauma from past relationships, from maybe rape or some kind of, whatever trauma, that client or patient has endured. Have you had special training in dealing with that?
Yes. So I have been trauma focused through all of my different fields. So starting with nursing, then moving into midwifery, because as a trauma survivor myself, it's extremely, extremely important to me for that to be an incredibly safe, really sacred space where if people feel like they're going into it, and I have some people that go in and they're like, okay, look, this is what I'm working with. This is what I want to get out. But the majority of us, we've stuffed it, we've buried it, we've layered it because we're surviving.
Mm-hmm.
We're carrying big, heavy things that sometimes we just need to tell somebody. Sometimes we have not told anybody. And I always, always, always anticipate for us to bump into things because life is long and life is hard. And I've not seen a single person on my table that's not had trauma in some facet,
Yeah,
whether we're doing pelvic work or not.
I can't even imagine this not sparking something in almost everybody, and
Absolutely.
yeah. Just bless you for taking that on, because I can't even fathom how emotionally draining that could be for both the client and the therapist. And
Yes.
you really have to learn how to ground yourself and do your best to take care of yourself and your patient at that time when you're dealing with such trauma. Man, that's
Absolutely.
gotta be hard.
Some days are heavy, just to be fully honest. I had one of those this week where it was a beautiful day and I could really walk away and be like, I feel so good in this field. I'm so honored. I'm so grateful to walk step by step with these women through this. I walked out of the building going, oh my God, am I enough to do this? Will I ever be enough to do this? And I talked to one of my mentors that evening and they told me, like, did you do a good job? I'm like, no, I did. I feel like I did. I confidently feel like I did my job. And they're like, then keep going.
Yeah.
Because, we are all fallible, imperfect humans that have been traumatized by a wide array of things in our lifetimes. And we're all piecing it together to just do the best, that we can to help each other. So, but yes, it's a big deal.
It is a big deal. Can I share my experience with you when I went in and held the baby?
Absolutely.
Is
Please.
that okay? So I was hanging out at Kikino one day and Megan had asked for somebody to come hold a baby during her session. And I was pleased to be able to do it. I was thankful I had a few minutes to be able to go in and hold the baby. And I gotta say, I was really, really impressed by the way you handled yourself with the mom. I mean, I could tell that the mother was, what's the right word? She wasn't confident in herself. Let's put it that way. She had a lot of questions about being a mom. And
yes.
I might cry. I can't relate because I'm not a mother, but I can relate to the fact that, she was in a position where she didn't know what to do. And she obviously wanted to be a good mom. And this is a very sensitive subject. As you can see, for me and for every woman out there, this is a sensitive subject, being a good mom, right?
Yeah.
And I gotta say, I was really, really, really touched by the way you handled the situation, and you were caring and kind and empathetic and loving towards this mother and child. And it makes me so happy to know that you are in this world, to be frank. And that
Huge for
I
me.
know. And that there are women that can come and safely talk to you about the fact that, their child might not be nursing for them, or they're not comfortable asking for help in some situations, and you're talking about the things that need to be talked about, like,
Absolutely.
does
Yeah.
your child latch, are you peeing,
Correct.
when you sneeze, I mean, just all the things that us women have had to really like be, we have to talk through pursed lips. We have to whisper when we talk about our period. We can't talk about these things in front of the men, It's like, no,
And
let's talk about this. This isn't.
absolutely.
So
Yes.
I really want to commend you for bringing that conversation to the forefront of your life and your work, and bringing it into our world as massage therapists. Thank you.
Oh my God. Thank you. I'm so honored to be here.
I'm
Absolutely. Every day.
I was blown away, impressed by you and the way I was very thankful to be in the same room and just listen and watch. And the baby was
You were
precious. It was just such a pleasure to be involved with that. But you know, I do think that we don't talk about it enough. And you're on the end of, the new life and the beautiful babies and all the wonderful things that come with that. But we've talked about the struggles, but you also get to see the beauty and
I do.
a new life being born, and how to manage
Yeah.
that, how to incorporate that into their lives. Do you want to talk
Right.
about some of the beautiful, wonderful things that you've experienced?
Sure. I mean, I'm a practicing midwife, so I literally get to catch babies, which is honestly it's the icing on the cake. So for me, the reason that I do all of it is for the women, because it's we should all still live in a village. Like I see this all the time. I'm like, if we lived in a village, this wouldn't have happened. Like if I would have had all my village sisters, we would have nipped this in the bud. Nobody would have gotten to here. So I get to be a part of the village. That's not a concrete village, but every single time, because I don't do a ton of births. I love bodywork so much. So I've moved more into repeat clients and families that I've been seeing grow for 10 years. Those are the families that I'm reliably serving at this point. So it's just, I mean, like every single day, I'm like, oh my God, like, how are you picking me to walk through this with you again? Like when you are in the full blown trials of natural childbirth, that like, you're like, me, you picked me. And I'm so humbled by that every time. I literally just came from a first appointment with a mommy who is going on her 6th baby and got to hear the heartbeat for the first time today. So like, and it's, I get to look ahead and be like, okay, no, I mean, I might get to miss Thanksgiving this year because I'm going to be with them. And then that's exciting for me. That makes my heart feel happy that I get to go and be with them, and they literally go through this incredible natural birth experience and bring their baby back with them. And then, I mean, I don't go away. I see these people at least times prenatally for at least an hour every time. Like they get a lot of me. And then we have the birth, and then I see them weekly until the baby's 6 weeks old. So, which is honestly, postpartum is when mothers need us. You have your baby in the hospital and then they see you again once at 6 weeks to offer you birth control. I'm like, no wonder our maternal mortality rate is through the roof, because so many are just, they're missing the point. They're completely missing the point of how do we actually support women. And sometimes my days are long and gnarly and kind of convoluted, where I'm here and there and I'm late on text messages, or, I'm 45 minutes late to an appointment that I'm doing at someone's house. It's not perfect, but every single day of that, I'm just very humbled and I'm just very honored. that I'm walking the space with people. So with bodywork, I'm turning like all of that really goodness, but then I'm seeing multiple people a day and doing it. I'm still getting to build relationships when they're pregnant. I still talk to them as soon as they've had their baby, and then they bring in, and they're breastfeeding. I'm excited for the day that I get to support a family on a next baby through another pregnancy, because I can see how that works in the bodywork world too. And that's a gift. That's something special that not a lot of people get to do.
That's
So
awesome.
I'm super honored to be one of the ones doing it.
I'm so glad you're a part of this community because, when you were working, I thought, have you ever watched the show Big Mouth? So it's a cartoon for adults. It's not for children, but it specifically talks about going through puberty, and is an episode in there that there's a midwife on there, and she radiates beauty. Okay. She is just this beautiful character on this show. And it reminded me of you when, and that, I mean, it was just so sweet. But anyway, I have a question for you, and I'm hoping that our listeners will be able to learn something from this today, which is, how can the massage therapy community help you in your efforts for postpartum? Like, what can we do when we have a client that has a child and then she comes back to us post birth, right, for her massage? Is there something that we do differently or know, or some advice that you might have for us?
Absolutely. Honestly, very basically learning how to assess if the abdominal muscles are separated. Okay. That would be because, which is so simple. You have them do a tiny mini crunch without engaging their belly muscles, and then you feel by what I'm talking about with diastasis recti, which again is a gap or a separation between your core abdominal muscles. And for some women, it's very functional. It's like a 1-finger gap. I saw a woman the other day that had a 4-finger separation, which is astounding. So that means she has no core abdominal muscles separating her outside world from her inside world here, right? Like this is very, very significant. And she had no idea. She's trying to figure out, why does my back hurt? And why is my belly so floppy, is how she described it. My belly, like, it's just so floppy still. I feel like it should be going back in. And I'm like, well, let's talk. I mean, there's a lot of physiological changes, but let's check something really, really simple. So, I mean, and we can't diagnose. None of us are diagnostic, right? You're not, I'm not. But you can give people the opportunity to even feel in their own body. Oh, wait, there's a gap between the two sides of my core muscles. And then giving them information that there are ways to bring that back together. There is online programs like the Mighty Mama movement. There's pelvic PT. There's crazy ladies like me, and that actually, like, hey, did you know that you have a gap in between your abdominal muscles after this delivery? A lot of times this goes back together on its own, but I wanted to talk to you, like, if there's ways, just get them information. Just let them know. And then as far as like hands-on things, my gracious, if you can work their shoulders and this upper middle back, like the breastfeeding posture, the mother's hunch that we all have, I call it carrying the weight of the world on your shoulders. And I bet you know exactly what I'm talking about.
Yeah.
When you get it back in there under the scapula, up in their shoulders, and they're like concrete. They're just like concrete. And that's something you can start working through the pregnancy in preparation for the feeding journey that's coming. Because I mean, all of us healthcare providers, they're like, okay, make sure you bring the baby up to you to breastfeed. Nobody does that. Everyone brings their own boob to the baby and they lean over, they hunch through that. And it causes so much strain through the neck and through the shoulders, through the upper back. So anytime you can give some love to those areas, especially working front and back,
Mhm.
to give some relief, working their arms, getting some mobility going, getting them in different positions. All of that is so beneficial. And they'll sit up off the table and be like, wow, that is so different. That helped me so much. It doesn't take a lot for them to notice the change.
Yeah.
It's going to take multiple appointments to keep it going, of course, but it's so easy to enact so much change because as a person who's feeding this new life form, this tiny, needy human, whether we're bottle feeding or whether we're breastfeeding, our instinct is just curl over them. We must protect them. We're giving our whole body, we're turning our heart to them. We're giving them our everything. Like, please grow, thrive, eat. And our here to here suffers immensely for
Yeah.
it. So
Yeah.
that's something that absolutely you can help every single mom you see.
And I know there are postpartum classes, massage classes that we can take, continuing education classes that help us, even more assess that situation with, post baby body, right? And how that works and how
Absolutely. Yes.
each
Mhm.
person. And now, how can we talk to a new mom without triggering all the emotions and maybe the postpartum depression? Is there something that you use that we could benefit from?
I mean, honestly, just listening to them and giving them a space, just go into it expecting you're going to trigger emotions because this may have been the first adult she's spoken to in a week. This may be the first time that she's out of her house and
Mhm.
away from her baby, and she may miss them so desperately that, you have someone leaking milk on your table. That's very normal, very expected. I would have something handy if you have a lactating woman, like an extra pillowcase, just to be thoughtful in that way. But no, I wouldn't say don't try to trigger emotions. I would say go in with a soft heart and open arms because honest to gosh, she might just need a hug. She might just need someone to hear her. And you
Yeah.
might be that person
Yeah.
that looking back on it, she's like, you have no idea, but you were a life raft to me that day
Uh-huh.
because you touched my body and you touched my heart, my body, even though it has recently birthed a baby and it's squishy and maybe it doesn't look exactly like I want it to. And maybe I don't know if it ever will. You touched me, you touched my body and you didn't ask, you had no qualms and you helped me when I was in the trenches. So no, absolutely. I wouldn't say avoid it. I'd say go into it and be willing to hug them and love on them and just treat them with the reverence that we all deserve, whether we're mothers or fathers or not, whether we're just humans. Treat them with the reverence that we should treat all humans.
Yeah.
And be ready to hug them.
I mean,
Ask them to drink some water.
yeah. Yeah. I mean, they've just come out of a very traumatic experience. And, a
Yeah.
birth is a huge thing. I mean, they made a human being. So, yeah, I mean, it's going to be emotional and scary. And, they're on lack of sleep and all their nutrients are going to their child. And I mean, that's a big, big deal. Um, can we talk about how we can work on pectoralis muscles while somebody's breastfeeding? Can
Yep.
you talk to us about that? Like what do we do? How do we avoid working on the pecs when they're, breastfeeding? What advice do you have?
So I would say it's completely on their comfort level and tenderness. So for a lot of women, it's incredibly helpful and it's feels amazing to have some of the tension taken out of it because I mean, boobs are heavy, right?
Mhm.
Always, no matter whether they're little or they're big, but they're extra heavy when they're full of milk. And that it's pulling. It's a strain, right? So I wouldn't say avoid it. Of course, have your proper consents for breast massage because you're all up in that area. But I do actual on breast massage very, very frequently with consent, obviously. But working through these muscles to her tolerance, I would say is the main thing. Because so much of the lymphatics, as you know, that run through so many of these tender areas, they come into play. I'd say if you're trained in lymphatics, if you can do some gentle lymphatic work along with some pec work, like she's gonna feel so much better. So like she'll feel her own breasts afterwards and be like, oh wow, this feels softer. I don't feel like, I don't feel as lopsided right now. But I would say just kind of really gauge it on them as far as how much pressure you can do to stick with lighter, because all of your nerves, all of your blood flow, everything is just so lit up as you're lactating.
Yeah. So maybe start with lymph drainage pressure, which is 5 grams of pressure, a nickel weight, right?
Less.
Or less. Yeah. And just see how she takes it and then go from there.
Absolutely. You go from there. I would always start with lymph drainage before moving into these other areas, because a lot of times, a lot of the sensitivity and tenderness, if you can get a good axillary lymph drain, good clavicular going, a lot of times their tenderness through their breasts diminishes immediately. And then you can actually work in these areas without causing discomfort.
Mm-hmm. Mm-hmm. That's amazing. I'm sure that you've seen so many women get such relief from this kind of work. Because I can't imagine like I said, I've never had kids, I've never breastfed, but I can't imagine how heavy that feels to have milk in your boobs. You're carrying around basically a backpack on your front is what I imagine it being.
Yeah. Your center of gravity has changed profusely in less than a year, where you've got a lot of weight in the front already, but it's lower, and then that's gone, but your weight's up here now, and it's your body has to re-regulate on how to even carry itself. It's a big deal. Babies are hard.
They are. And one of my biggest sayings that I like to reiterate to all my clients is to be kind to yourself. And I feel like that's just a huge part of the conversation that we have with our patients on a regular basis. Because everybody's so hard on themselves. And I think if we could just learn how to be kind and understanding to ourselves, I think that would just make the world so much just a better place to be in, because then we'll be kinder to others and each other if we're kinder to ourselves. But I want to change the subject for a minute, if you don't mind.
Okay.
John, I know John and you work, correct me if I'm wrong, you do a rebirth. Is this correct? Can you
Yes.
talk about what that means to have a rebirth, if there's some kind of a trauma that happened during birth, and why you would want to do a rebirth and what that entails, and kind of why you would do that? What does that look like?
Absolutely. So a rebirth appointment, one thing that we do there's exclusively every single time is we start working with the mother. So every time a mom comes to us, the mom gets work first before the baby. A team, they're a unit. So mom's on the table. She's getting some light, gentle work where we're working through if she's having, emotions come up from the birth trauma, or, which this, again, to backtrack, this can be especially for a surgical birth or a cesarean, because biologically, we are intended to undergo cranial compression to come through the birth canal, which helps to activate our craniosacral system. We're intended to get our noggin squeezed through the birth process. And if that doesn't happen, there are certain systems in our body that are not jump started through that process. So the rebirth is an opportunity to take the baby into some delivery type positioning very lightly. Again, we are sticking to craniosacral therapy pressures, so super light. But so frequently the baby has so much restriction in their body that it doesn't take much pressure to put them through the process. But I'm rabbit trailing. So first step, mom's on the table. Okay. Baby's right there with us. Everyone is staying very close. A lot of times John and I will do these appointments together, or we're doing them separately. So family's all right there. Like if dad's there, he's got a chair close. He's holding mom's hand. We're finding where in her body, where are you hurting? Where do you feel empty? What are you experiencing it like? And just being really, really, really present with her in that. I see so frequently that, they'll have these deep, deep emotions come up. Like, I just felt like my birth's not complete because I didn't have my mom with me. She passed 2 years ago. Or we transferred from a birth center and I wound up with a C-section. So I just, they have so many different, very big, very valid emotions that they're working through. So it's just being really present and really listening with them through that process. And then seeing where are they holding that in their body? Because even the most beautiful birth on the planet is still physical trauma. And we're taking a human and shuttling them through our pelvic bones and some very delicate tissues. And that's the easy way to do it. The cesarean, that's really hard. We're cutting through multiple layers of abdominal tissue. So, my gosh, women are tough, Julie. And then we do this multiple times. Oh my God. But anyways, so we've treated mom. Honestly, we spend the majority of the appointment on mom. And then when we sit her up, and hopefully her body is feeling immensely different. Her visceral system is much clearer. Her lymphatic system is clearer. Her body feels calm. If she's in fight or flight coming in the door, she's not in it when we start working on baby. Like she's kind of thumped back in her body. And, you'll see these women kind of like almost looking around, like it's a whole experience. You'll see them like they sit in the chair differently. And it's just as honoring to me as being in a physical actual birth with people, because it's so wildly big deal. And then we bring in baby. Okay, baby comes close. Mom, we're sitting right across the table from each other. She can touch baby, pet on baby, anything that she's liking. I personally have a goal to get as far in an appointment as I can with baby, content and calm and happy. And then we do come to a certain point when we're doing the rebirth. A lot of times the babies, they're like, hey, excuse me, like this is kind of rude. I've already been here. I've already done this. So, but you put the baby back into a flexion position. So with chin tucked, legs up, and then you're giving them the opportunity to push. Babies are active participants in birth. So when it comes time to be pushing, the baby is giving a birthing push as well. It's like they're little swimmers that kick off. And you'll see in labors where they'll be like, oh, it felt like the baby pushed at the top. Well, they did. They're helping. They're trying to help. So we're reactivating. Yeah. It's like the babies are not actually incontinent. They're fully aware that they need pee and poop. It's little details like that like I just love, and I'm so like super birth nerdy about. But anyway, so we very gently are holding baby, and then we're holding mom with our presence. And then through the rebirth process, the baby is shifting and turning and taking us back to wherever they needed a little bit more time or a little bit less time through the birth experience. They're showing us where is their restriction and how are they holding it in their body. And the baby will be pushing, maybe sputtering a little bit through the process, even though the pressure's really, really light. And the fascial tension is leaving the baby's body. And then the baby will rotate through the mom's hands, just like a pelvis, and go back. And that is an incredibly, incredibly emotional moment for everyone in the room. I mean, it's frequently like everybody is crying because it has just sent everybody back to that moment. And mom is welcoming her baby back into her arms. It's really frequent. Like, we're going to leave them in a room and move ourselves to another room and let them be skin to skin. Let her nurse her baby. Let her latch her baby with this completely different experience. And yeah, it feels like kind of a big deal to be a part of.
It sounds
So
amazing.
yeah, thank you. Yeah, it is.
So if somebody that's listening to this podcast finds some inspiration here and wants to go down the path of becoming a midwife or learning more about doing rebirths, how would one do that?
So as far as midwifery goes, you have to decide what kind of midwife you're going to want to be, and then pursue it from there. If you're going to be a licensed midwife versus a nurse midwife, that's the first big decision to make. And then you look at schools. And the majority of midwifery schools is you have your didactic learning online, and then you have hands-on training with your preceptor, which is a minimum of a 2-year program for the licensed midwife. So me personally, I took it slow and caught twice as many babies as I needed to for licensure. It would have taken me about 4 years. So it's a full immersive experience as a student midwife. You're getting called in the middle of the night. You know, if your preceptor is seeing appointments, you're seeing appointments. It's almost like a trade school style training where like you're fully immersed into it, into these people's lives, into their experiences. And then you're doing bookwork and tests on the side as well. And then at the end of the program, when you've caught, X number of babies for your certification, then you go and you take your boards. You take the state test. Well, it's through NARM, National Association of Registered Midwives. So is our current governing board for like the nation. And then I'm actually, as a midwife, I'm doing the same board as the massage therapist, TDLR. So we're all kind of grouped together. But yeah, you get licensed through them just like you guys do. And it's a whole process, but it is for you guys as well, right? It's anytime that you're in a people-oriented field, they're making sure that you actually know what you're doing, and thank goodness for that, right?
Yeah.
So as far as learning more about rebirthing, about bodywork in general, I'm always happy to sit down and talk with people. I'm at Kikino 4 days a week right now. And I always enjoy having students in with me. I always enjoy having other therapists come by. I'm always happy to explain, what am I doing? What the heck are we doing? All of these things. I know John always says too. So yeah, they're more than happy to reach out to us at Kikino.
I know Kikino has a lot going on in this area. Is there a program that a licensed massage therapist can go to at Kikino to better understand this path?
As far as like the mom and babies?
Yeah.
Okay. I don't know that we specifically have like just that. I know we have a lot of continuing education opportunities that you're kind enough to help with as well. But that's like we should, right?
Well, yeah. I mean, I just, I'm really impressed by the way Kikino runs their school and their business. And, I want to send more people your direction. So if you are interested in going down this path, I think that Kikino is a really good resource to start with if you want to look at this as a niche. And I know Megan and the other people at Kikino are more than happy to help go through this with you and help you achieve that goal. So if you're in the Plano, Texas area, I would highly recommend reaching out to Kikino for that kind of thing. Even if there's not a dedicated program for it, I know that they can help you. So
absolutely. Now, a lot of times it would be like a person-on-person basis. something more tailored to their needs. It's a sensitive subject. It's a sensitive clientele. So yeah, it's been a wildly convoluted road to get where I'm at. So I'm all about making it a little more streamlined for somebody else.
Megan, can a male be a midwife?
Absolutely. So the word midwife is German. It's midwife. So it actually means with woman. It has nothing to do with being a wife. But yes, it's not common, but absolutely. Men are accepted into different midwifery schools, different midwifery programs. I mean, look at obstetrics. It's primarily male dominated, but absolutely no. I have not personally met one. We have a very well-known one that serves up north in Michigan. So his tag name's Mr. Midwife. And
that's cool.
And he's phenomenal. And yeah, it is. I'm like, well, that shows you how few there are that you managed to get that tag name. Like, but yeah, I mean, it's a thing. Absolutely.
Awesome. Is there anything else you would love to share with our listeners or educate us massage therapists in as a midwife?
Wow, just a huge thank you guys to because honestly, I'm newer to this bodywork world, and so many of y'all have been in this for a long time and serving people and serving families, and so just thank you. Thank you for touching people's bodies and helping them to find their own space and their own healing and their own beat. It's an honor for me as a clinical person to have come into this world and be so welcomed. But just thank you to all of you, whether you're a student or whether you're a new LMT or whether you've been doing this for 40 years. My gosh, guys, it's a big deal. It's a big deal that you therapeutically touch other people's bodies. Touch is so hugely undervalued, hugely, epically undervalued. And y'all are out here fighting the good fight every day. So thank you so much, just all of you. And thank you, Julie, for having me. I've absolutely enjoyed this. You're always a delight to talk to. So thank you for the invitation.
Well, I'm very thankful that you took your time to meet with me and talk to us today on this. And I want to say on behalf of massage therapists, thank you for appreciating us, because I think touch is undervalued in our society.
Yes.
Undervalued, underappreciated, and necessary. And there's somebody else appreciate that, feels good. So on behalf of my listeners, I'm going to say thank you for appreciating us, for touching people, because it is a big deal. So I appreciate your time.
Yes. All right. Thank you. Thank you for yours. Bye-bye.
Thank you so much for joining me on the Handcrafted Therapy podcast. I would love to hear from you. You can email us at podcast@handcraftedtherapy.com, or you can come by the store. It's at 3303 North Central Expressway, suite number 240 in Plano, Texas, 75023. Or you can connect with me on social, Instagram, Facebook, #HandcraftedTherapy. I'm Julie Alexander, and I wish you a very happy and healthy day.